My name is Al Amalados and I'm the Deputy Medical Director for Medical Education for Sussex Partnership NHS Foundation Trust. And on behalf of the Trust, I would like to welcome you to your new posts that you will be taking up with us. By way of introduction, we are a large mental health organisation. We provide services in West Sussex, East Sussex and Brighton and Hove out of over 140 sites. We have about 100 junior doctors working with us, together with a similar number of consultants and associate specialists. Mental health is very important, regardless of which medical specialty you finish up in, because you will always come across people with psychiatric illness, and you need to be able to recognize that and at least have a discussion about how their problems can be managed.
Recently we expanded a lot the foundation posts in psychiatry because there is a national drive to have as much exposure to community posts and mental health posts for foundation doctors, because you can develop generic skills that are useful for any career, but also for foundation doctors to have experience of mental health. 1 in 5 of the population will develop mental health problems, so it will be almost impossible to do any career in medicine without coming across someone with a mental health problem.
I'm Arun Kishore and I'm a consultant psychiatrist and the tutor for Worthing. The area covers Arran, Ada and Worthing. So in Worthing, which is where all the centres are, you've got Meadowfield Hospital, which is our inpatient unit. This is on the Swandene site.
This is Meadowfield Hospital, where we have 3 wards. There's 2 mixed gender working age adult wards and 1 mixed gender elderly ward for over 65s. All the wards have 2 or 3 junior doctors working on there, a mixture of foundation trainees, GP trainees, core psychiatry trainees and higher psychiatry trainees as well. And all the wards have a consultant on them as well.
At the Swandene site, we've got other units that you might need to know. The Burrows unit, which is for older people's mental health services. And then you've got the Selden Centre, which is for the learning disabilities services as well.
The Selden Centre is a 10-bedded service for people with learning disabilities who either have increased challenging behaviour or issues around their mental health that can't be supported safely in their community settings or within their own homes.
On the Swandene site, you've got Chanctonbury, which is where we have a postgrad every Wednesday afternoon. Besides these, we've got clinics in the community. And the clinics are in Worthing. They're at Arran House, which is in Liverpool Gardens in Worthing. In Ada, which is in Shoreham, the centre is at Glevelands on Middle Road. And in Arran, we've got our centre at Pepperville House. Now, besides these, we have an inpatient unit for long stay or longer stay patients, which is at Shepherd House on Brighton Road in Worthing. A large part of your time, about 60% I must say, would be spent in the community or on the wards, depending on whether you're placed as an inpatient or in the outpatient clinics. The community clinics are largely made up of outpatient clinics, and you would have opportunities to interact with the community teams. You would also have a lot of psychological resources to look forward to. Similarly, on the inpatient services, you have the advantage of having patients in the wards and also the support from the teams there.
The typical job day would be going in, just checking if there are any issues with the patients. I work on an old age psychiatry ward, so some of them do have medical issues that need to be dealt with. Then often we will have a ward round, at which time we'll support our consultant to see the patients. And then usually in the afternoon we would be tying things up, checking blood results if there are any outstanding, and chasing jobs. Typically as an FY2, I'm responsible for most of the medical issues that arise with our patients.
Hello, my name is Sophie Wong, and I am currently a GPST1 and in my rotation in psychiatry, and I'm based in community and mostly in Cleveland's in Shoreham and Erin House in Worthing, and also the Psych Liaison in Worthing Hospital. My typical day would start with sitting in the clinic, either shadowed by Dr. Kishore or Dr. Gordon, or doing a new assessment for new patients myself. And I find it very helpful for GP trainees because in the future we were based in community, and from this rotation I think I have a very good exposure to the patients with psychiatric problem or mental health issues in community.
About 40% of the time you'll be on call, which means that you'll be on your own largely. But remember, you have the support of a good team. You've got the consultant who's on call with you. Please do call the consultant if you have any questions when you're working alone. And also remember, you've got resources like the senior nurse practitioner who will be at A&E in Worthing. They're a good resource to call on if you have any doubts about particular people or about situations as well. And of course, do fall back on the support that you have at Meadowfield from the nurses as well.
It's a full shift rota, so you have day on calls which run from 9 AM until 9 PM. Usually you won't get bothered by the wards too much during that time period because they have their own ward teams there, but after 5 o'clock things pick up a bit. So usually you can do your day job between 9 and 5, and then in the evening between 5 and 9 you're doing more of the urgent jobs. Then night shifts, they're just dealing with things as they arise, medical problems, rapid tranquilization occasionally, and to see new patients as they come into Meadowfield, and also going to A&E to help clerk in new patients.
There is a mental health liaison service based at A&E. Occasionally at times when they are very busy, they might ask us if we can help.
Besides this, we've got teaching sessions every Wednesday where we've got a case conference, a journal club, and lectures.
Every Wednesday afternoon there's teaching on the Swandene site that is attended by all the consultants and all the trainees, junior doctors. We have an opportunity at this meeting to do case presentations and present journals or anything else interesting that we might want to present. And of course we can have the opportunity to listen to everyone else's presentations as well. Occasionally we have outside speakers or guest speakers to talk about an interesting topic or lecture as well.
The Ballant group, which goes on every Monday from 1 to 2, is a useful resource to look forward to in terms of psychological therapies. Mentioning psychological therapies, I must say, when you're in the community, do go to the group treatment program, which is our major psychological resource where you will see people in groups.
I'm always interested in ADHD and learning difficulties, which I didn't have experiences before, and I'm very fortunate to stay with Dr. Kishore, who is an expert in this field. And I have witnessed how these medical treatment and this psychiatric intervention can help these people to function.
So there's always opportunity for people to do audits, and people can speak to their supervisor who can give them ideas, or you could go with your own ideas, and the supervisors are, in my experience, all very helpful.
Now remember, you've got an hour of weekly supervision every week, and make use of this to discuss cases, to do your case-based discussions, and also your workplace-based assessments. Besides this, what we'd also like is for you to give feedback and to receive feedback. Now, giving feedback, we would support you in giving any sort of feedback, be it be positive or be it be critical. Do give it to us. And also remember that you will receive feedback, and this will be from your consultant supervisor. You will get feedback from your colleagues, and also get feedback during the postgraduate teaching sessions on your presentations. You can also ask our nurse colleagues for their feedback, and this can be as a part of your 360-degree feedback that you collect as a part of your posting.
The people in Meadowfield, they are very helpful. Those the psychiatry trainee consultants and also the nursing staffs. They're very supportive. Whenever I have doubts or anything, I can just pick up the phone and phone the onco consultant and ask for questions, and they are very friendly and happy to offer me answers.
Yeah, there is a lot of support. Obviously, everyone's very aware that psychiatry is very different to medical surgical jobs, so that's why the support is there from everyone, from the other doctors to the nurses. A lot of the admin staff are very helpful.
The induction is very helpful. They give us some good materials to read beforehand and good learning module to do beforehand. And there are a lot of things that's not known to us before, like Mental Health Act or pharmacology, how to do a rapid tranquilization, those things. But these essential things will be reiterated in the induction program.
You have 4 days of induction, during which a range of things are covered. But I would say it is a little bit daunting when you first start out, because some of the skills you're using you maybe haven't practiced since medical school. So taking a mental state examination and mental health history can seem a bit foreign at first. But you are well supported, and all of the consultants are very friendly and willing to give advice. So generally the transition into it is not as difficult as it first seems.
In the induction, we are given annual leave forms that we fill in, and then your supervisor would sign, and then you email it off to medical education. Making swaps within the rota, you would organise it between trainees and then contact the rota coordinator and ask them if it's fine to do that swap.
I think a helpful thing when you're first starting out is to familiarise yourself with the admissions process. So there are a number of forms that need to be done. The bulk of those are on Care Notes, which is the computer system that we use, but there is also some paperwork. And also to make sure that the investigations are ordered. So they include blood tests, an ECG and a urine dip. It's well supported, there's a good atmosphere here. The nurses are great, they're all very well trained. And I've found actually there's a bit more medicine than I expected. Being on an old age psychiatry ward, there are more medical problems to deal with.
What I find very interesting and challenging is the psych liaison part, which I really enjoy. And we have a very good exposure and very supportive team in the Worthing Hospital.
The best thing that I've enjoyed the most is working in a different area of learning disability I've not done before, and with a very supportive and understanding team.
I find it really, really rewarding and boosts my confidence in that we can do a lot to help people.
Some trainees find psychiatry exciting. For others, understandably, it can be anxiety-provoking as well. If you do feel yourself in a difficult situation, remember to ask, and we'd be happy to help you.
I do hope that your time with Sussex Partnership will be a profitable experience for you, and that you will learn as much as you possibly can in the 4 or 6 months that you are with us.